Hi girls, in this video we'll be looking at another paraphilic disorder which we call as the transvestic disorder. Transvestism in general means cross-dressing. We look into what transvestic disorder is. Okay, so according to DSM-5, heterosexual men who experience recurrent, intense, sexually arousing fantasies, urges, and behaviors that involve cross-dressing as a female may be diagnosed with transvestic disorder if they experience significant distress or impairment due to the condition. Most of them are harmless unless accompanied by illegal acts such as theft or destruction to property. So this is another paraphilic disorder which does not intend harm to another person. It does not involve a victim. It is transvestism as such is a brief private activity. Homosexuals also cross-dress, but they are not considered as people with transvestic disorder because they don't do so for sexual pleasure. And these heterosexual men who cross-dress do not generally go out with the clothing of the opposite sex. So this is an important distinction that we need to remember. Okay, so generally transvestism is different from transvestic fetishism. Transvestic fetishism is when cross-dressing becomes the person's only source of sexual arousal. That is, they are able to achieve orgasm only when they cross-dress. And some men who cross-dress also show very strong autogynephilic tendencies. What do these mean? Autogynephilic tendencies are tendencies in which the men show a strong desire to be treated like a woman, or they are attracted by the image of themselves being a woman. In other words, they are attracted to the female inside of them than attracted to a female outside of them. And not all men with transvestic fetishism show a clear evidence for autogynephilia, meaning that they may not house these desire to be seen or treated as a woman, but then they can still cross-dress. Okay. Some men, as I told you, may not have clearly apparent fantasies of becoming a woman, but still cross-dress and behave like typical fetish, focusing on specifics of their preferred female clothing. And among transvestic fetishes, the strength of these autogynephilic fantasies strongly predicts gender dysphoria. Gender dysphoria is a newer term that you are coming across right now. Gender dysphoria is a distress a person feels due to a mismatch between their gender identity and their sex assigned at birth. What was formerly called as gender identity disorder in DSM-4 has now been renamed as gender dysphoria in DSM-5. So this is when the person feels that his biological sex is not how he experiences his gender. So that is the mismatch that you see in these patients. Okay, this is a very interesting study that has been performed in the year 2005 by Langstrom and Zucker on transvestism, and these are the key findings of the study. The prevalence of this disorder is very low, and among men who had cross-dress, there were a lot of people who had suffered sexual abuse before the age of 10 than men who had not cross-dressed. These men were more easily sexually aroused, had a higher frequency of masturbation, had other paraphilias like fetishism and masochism, and vast majority are heterosexual, and about 83% of transvestic men are married, and many men generally try to keep their cross-dressing as a secret till their partners find it out. Okay, so no specific causes have been determined for transvestic disorder. Transvestism may enjoy the feeling of violating a taboo that is associated with wearing a clothing of an opposite sex. Some may be viewing it as a fun version of role playing, and others may cross dress out of curiosity. But whatever it is, it has been observed that in childhood, cross dressing causes excitement, and which may after puberty become sexual excitement. More males cross dress than females, and partly because there are exclusively labeled women's garments than exclusively labeled male garments, and women who cross dress are more so socially permitted. So we don't see a condition of transvestism. We don't define a condition of transvestism when a woman cross dress. And some cross dressers seek therapy for themselves, but mostly majority of them are brought in by their partners. As I told you, not many people who cross dress experience significant distress, but if it is going to a point of hampering their personal, social and occupational functioning, then they may definitely seek therapy. And as I told you, since it occurs in relationship to other disorders, it's quite possible that some cross dressers seek therapy for other reasons such as substance abuse, depression, or obsessive thoughts and compulsive acts, or gender dysphoria. And generally over a period of time, when the sexual excitement associated with cross dressing fades, sometimes these people may stop the cross dressing act itself. So this brings us to the end of this video. Thank you.